Fracture dislocation and the associated nerve injuries. So here looking at the fracture of the clavicle. This involves the brachial plexus. Next, looking at the anterior or the inferior shoulder dislocation. So in such a case, there is the axillary nerve which is involved, and this is the circumflex humeral. Next, looking at the proximal humerus fracture. So in case of proximal humerus fracture, the involvement of the axillary nerve is present. Next, looking at the shaft of the humerus fracture. In case of the shaft of humerus fracture, this involves the radial nerve. Next, looking at the supracondylar fracture. This is of the humerus. In the supracondylar fracture of the humerus, this involves the anterior interosseous nerve greater than the median nerve greater than the radial nerve. Next, looking at the medial condyle. Medial condyle of the humerus. This affects the ulnar nerve. Then, in case of the posterior dislocation of the elbow, this involves the ulnar nerve greater than the median nerve. Now, looking at the Monteggia fracture. In Monteggia fracture, what is involved is the pin, that is the posterior interosseous nerve.